My name is Janet Leith Alexander. I'm an assistant professor of ophthalmology and pediatrics at the University of Maryland School of Medicine in Baltimore, Maryland. I'm a pediatric ophthalmologist, which means that I diagnose and treat a variety of pediatric eye problems using different types of interventions, from glasses and contact lenses to laser procedures and incisional surgery to improve or preserve vision and visual function. Some of the diseases that I treat are caused by problems in the front part of the eye, such as the cornea, iris, and lens. Some of the diseases that I treat are in the back part of the eye, involving the retina and optic nerve. As a pediatric specialist, I'm able to treat diseases and injuries to all parts of the eye and orbit, and I focus on the diseases that occur in children, which are sometimes very different than adult eye disease. Treatment of eye diseases in children is more urgent than in adults for two reasons. First, children generally cannot understand or explain an eye problem and seek out medical care on their own. Secondly, the visual system is actively developing during childhood. If a child is not able to see clear images in their early years of life, their brain visual pathway is not able to fully develop, and vision problems corrected in adulthood may not offer them much benefit. Pediatric eye diseases are a significant public health concern. Cataracts and glaucoma in children are the most common cause of preventable blindness worldwide. Pediatric cataracts can result in poor visual outcomes and decreased vision-related quality of life even after surgical treatment, often due to the development of glaucoma following congenital cataract surgery, one of the most sight-threatening complications of congenital cataract surgery. Glaucoma after cataract surgery accounts for 20% of all childhood glaucoma and occurs in 30% of congenital cataract patients in the first 5 years following cataract surgery. More than half of eyes with glaucoma after congenital cataract surgery have resulted in poor vision. While the causes of this complication are poorly understood, numerous studies confirm that structural risk factors contribute to glaucoma after congenital cataract surgery. These young patients have decades, maybe up to a century, to live and enjoy excellent vision, making even rare pediatric ocular diseases of high impact in terms of productivity years rather than disability years. Retinopathy of prematurity, better known as ROP, has caused blindness in 50,000 children worldwide. ROP results in 350,000 years lived with disability due to the incredibly early onset of this particular eye disease. About 500,000 U.S. babies are at risk for ROP and are screened each year. Globally, about 15 million babies are screened for ROP each year. Infants that require treatment following their screening receive either an injection with a special medication or a laser treatment to prevent blindness from retinal detachment. While cataracts, glaucoma, and retinopathy are vastly different problems, they share some common threads. First, they are all diseases that, if treated quickly and carefully, the risk of blindness decreases tremendously. Secondly, all of these diseases can be evaluated using advanced imaging techniques and quantitative image analysis techniques, including machine learning. In my lab, I use high-frequency ultrasound to image the complex three-dimensional anatomy of the front part of the eyes of children with cataracts and glaucoma, and I compare those images to age-matched controls. In doing this, I can identify very subtle structural features that correlate to risk of developing problems or complications in the future. In this way, I am able to turn each ultrasound image into a crystal ball and get a glimpse of what the future may hold. This predictive power can help clinicians understand which children are at highest and lowest risk and allocate resources accordingly. It may allow clinicians to identify complications sooner, before significant damage can occur. For retinopathy of prematurity, I'm developing a specialized imaging technique with my partners in industry. This imaging technique is called laser speckle contrast imaging, and this may help us to guide management of retinopathy of prematurity. Currently, the treatment of this disease is based on structural changes to the retina and retinal blood vessels. By using laser speckle imaging, I am able to see the dynamic flow of blood within each vessel, which may help us better diagnose and treat ROP in the future. As a pediatric ophthalmologist, my vision for the future is that each ocular image provides clinicians with not just a quick check of a few specific features, but a complete summary of all of the features, both structural and dynamic, so the clinician has the maximal amount of quality, quantitative, objective data. From this, we can understand how our images can inform our management and improve vision outcomes for our youngest patients.